Hello, this is Dr. Reed Omary from the Green Leaf blog. I'm here today with Dr. Wynne Armand at the Clean Med 2025 Medical Convention. This is being held in Atlanta, Georgia, and Dr. Armand is an internist at Massachusetts General Brigham Health System. She also is on the leadership team of the Massachusetts General Hospital, a group that is linking the effects of climate change, sustainability, and human health. So great to have you here today.
Thank you. Nice to be with you.
So I really am interested in your perspective in linking education about climate change and planetary health into the quality system within healthcare. Can you tell us a little more about that?
Absolutely. I think that education is fundamental to change. So if we want to promote change, it's one of the levers that is important to start with. And so whether it's addressing education for patients about keeping them safe, or addressing education to clinicians so that they can help manage these patients in the setting of climate change, or change how they practice medicine as we can try to address our footprint in the healthcare sector, because as we pollute and have more waste and produce more greenhouse gases, that ultimately will affect our planet as well as the health of our patients. So they are all linked.
That's wonderful. Can you tell us how you actually have done that? Because we know that physicians are very busy. How do they get educated? How do they find time for this?
Well, one of the tools that we were really lucky to be able to use at Mass General was our quality incentive measures, which we offer twice a year to all of our physicians and psychologists. There's a built-in incentive for clinicians to complete these measures. And so we had the great fortune of using one of these to be focused on education regarding healthcare sustainability.
Now, physicians are very busy, and with good reason. They will often not take the bait of trying to learn something that they don't consider relevant. What was the uptake in the educational modules?
So we had 95% of our clinicians that were offered these voluntary modules complete them, which is amazing. That's over 2,000.
That is incredible.
Yes, it was over 2,400 clinicians. And so they had to complete 4 educational modules that ran about 35 minutes with some interactive assessments, and then complete a very short survey afterwards, and then they would get their financial incentive.
That's wonderful. And where did you publish this?
So we published our findings in JAMA.
Wow.
We published our findings about clinician attitudes towards this training with respect to their demographics and specialties.
Well, congratulations. That's such a high bar to publish in JAMA.
Thank you.
Well, what last words of advice do you have for our listeners? What would you recommend, a call to action, if you will?
Well, like I said, I think it really starts with education. So whatever way you can do it, and trying to incentivize it, because we all respond more to the carrot than the stick. And this is an issue related to quality. Not only is there potentially cost savings, but clearly it also addresses our footprint and in terms of our emissions. So it's a win-win situation if we can make a difference here.
Well, thank you, Dr. Armand. And I think that here's to more carrots. I think we need more of those in healthcare right now. So all my best, and thank you for joining us today.
Thank you.
This is Reed Omary from the Green Leaf. Thank you.